And so I'll just go through a few things. So, how long are people contagious? So that's a big question that we're really trying to pin down right now, and we've got a lot of good evidence. So typically, it takes approximately 2 to 10 days for somebody to get have symptoms of COVID. Okay, if they're going to get symptomatic. Symptomatic meaning you feel sick, you coughing, you're tired, feel like your body is just hurting everywhere. Some people get rashes, some people get diarrhea, and some people lose their sense of smell and taste. So those are the symptoms we're talking about. What we found is when you get infected, the time that it takes for that virus to reproduce in your body and to cause havoc takes a few days. A day or two before you're actually symptomatic, you're already spreading that virus. Okay. Right. And so that's dangerous because you could have been sick for 3 days prior and been spreading it already. And then you're still contagious. Your peak of your viral load, or how many viruses are in you, is usually when you're really feeling bad. And then a few days after that, you're still contagious. Okay. Now, what we have discovered, and some data I've seen on the CDC, is where if you've had a resolved case of COVID, okay, and you hear some people still testing positive days and days later, 10 days after you don't have symptoms anymore, what we're finding is we're not, even if you have a positive test, we're not able to grow viral cultures, meaning we can't take your blood and grow it in a microbiology lab like a chia pet and see if it's an active infection. And so what we've got now is usually about a 10 to 14 day course, and you'll usually be asymptomatic. A few days after that, you're not really contagious anymore. Okay, but yet again, we're gradually finding this out. We are gradually finding this out. And that's why we're telling people, stay back for 5 seconds, okay?
Yeah.
Let's just sit down and figure this out, okay? Because that's what people have to understand. And what our leaders aren't doing is trying to get that balance between the economy and infection rates. That's what we need to focus on, okay? But nobody's focusing on that, especially in this country. And that's the issue that we have in America.
I made a guy called the other day, and he was telling me how this is more a money thing. They know what they're doing. They're controlling it exactly the way they want it to go. You know what I'm saying? They know exactly what they're doing.
Mm-hmm.
They knew it was here in September.
Mm-hmm.
And it's real political. You know what I'm saying? This whole thing, they making the numbers go up that ain't there.
Mm-hmm.
They sending people in frenzies to certain areas. I'm trying to be careful what I say. You know what I'm saying?
Right. And that's a good point you bring up. And so let me break down the finances of medicine and COVID. Okay. First, there are thousands of little rural hospitals, or what we call critical access hospitals, that are losing and hemorrhaging money.
Yeah.
Okay. They may have a bunch of COVID patients in their facility, but they are hemorrhaging money. Okay, that's first and foremost. So I couldn't tell you any healthcare system right now that's saying they're making a profit. Okay, and so we've seen a lot of things where people were talking about, yeah, if you put them on the ventilator, you get more money from Medicare and stuff like that, and you do. Okay, if I put you in the ICU, that's a highly specialized unit. Okay, it takes more medical care for that one person. So the nurses are very well trained just for extremely sick, damn near dead people. They usually only have 2 patients at a time because there's so much detail with it. So that costs money. to have specialized rooms in the ICU. That costs money. The doctors, that costs money. The equipment and the monitors and the people to read the monitors and to watch people 24/7 costs money. So if I had, let's break this down. If I had, say, a reimbursement from Medicare, I got, say, 40 grand for one COVID patient on the in the ICU on a ventilator, okay? I get 40 grand. And say I have a bunch of people. So let's just throw 60 out there, okay? 60 times 40,000, you get it. That's like $2.some million, okay? However, one, Medicare pays bulk payments. So no matter how long that person is in the hospital, what you get is what you get. The typical ICU bed, the ICU bed costs about $1,500 a night. And I'm underestimating that. And that's not including the ventilators and the doctor's fees and the x-rays and stuff like that. So if somebody is costing, like, let's say $2 grand a day, and they're in the hospital for 10 days, okay, you're not making a lot of money, okay? You're just not. Because all of a sudden, you're not doing a lot of elective procedures, your colonoscopies and things of that nature, you know, men getting hernia surgeries or any other procedure, okay? Right. So you're not getting that revenue in. So it's all dependent on this so-called getting all this money from the COVID patients, whereas the length of stay in the hospital was extremely long at first, okay? Extremely long. Like people were spending 5, 6, 7 days, more than that. Okay, so that money gets eaten up like that. Okay, yeah. You know, $40,000 to the average person is a lot of money in the hospital. Okay, that can be a drop in the bucket. So at the end of the day, if I had somebody costing, and I'm underestimating, $2 grand a day, and they've been there for 10 days, and then say if they're older and they got to go to a long-term acute facility, aka a hospital that houses people that have to be there for weeks on end, then they have to go to a nursing home for convalescence. Guess what? Medicare still only pays you a little over $40,000.
Go to your email.
So nobody makes money.
Mm-hmm.
That's what I want to break down to people. All you're hearing is, yeah, if we put COVID down, we get the ventilator, we get this money. Now, if I got pneumonia real bad, or the flu real bad, and I needed a ventilator and stuff, it'd cost, I'd get the same amount, damn near the same amount of money. Okay, yeah. I would. Okay, but people don't know that. People don't understand that. Okay, because that's just how medicine works in America. This is specifically for America. So yet again, people are not making money. Now you'll see people still getting bonuses, CEOs and stuff like that, still getting bonuses and such. Okay, that's a whole nother thing. But there are thousands of little hospitals all over this country that are damn near bankrupt because of COVID. Okay, so this is not a money-making scheme. This is not, okay, in any stretch of the imagination. Yeah. All right, and yet again, that's just the facts. That's the facts. And then some people will say, okay, well, what about the other people in the hospital? Here's the thing. A lot of people aren't going to the ER now because they're scared of COVID. A lot of people aren't going to the clinics now because they're scared of COVID. So a lot of things are draining money out of a hospital system. Okay, and that's just facts, y'all. That's just facts. And I'm telling you this as a person that works in primary care that treated COVID patients in the outpatient and in the nursing home setting. It's just people are losing a crap ton of money. These nursing homes that are getting ravaged, these are people's grandparents, great-grandparents, brothers, mothers, fathers, sisters, right? In these places. When you have a COVID outbreak and you're having to do all this stuff where you have to send people to the hospital and stuff like that, these nursing homes are losing hundreds of thousands of dollars, millions of dollars because of that. Okay, so yet again, nobody's making money.
Right.
Okay, nobody. MD Anderson hasn't built a new building in the past year because they got all this COVID money. Okay, New York hasn't built the new Empire State Building because they got all that COVID going on. Okay, and then on top of that, 10 to 12% of the fatalities that of COVID are from healthcare workers. Okay, healthcare workers. So now, since we've got a nursing shortage and a doctor shortage, like we've always had in the history of mankind, all of a sudden those people get sick. Guess what that hospital can't do anymore? Treat patients. You're losing money. I mean, you know.
So what you saying in a nutshell, it might come a time where you might not have no motherfucking where to go.
Right.
Hospitals
exactly.
might go.
And this is, yes, and this is the issue, everybody, is that the people who are getting sick and needing to be in a hospital in certain areas overwhelm the capacities of the local hospitals. Montgomery, Alabama is going through that right now, okay? Mobile is having an issue. Birmingham is starting to have that problem. Why? Because they had to get more patients from Montgomery, okay? New Orleans ran into that problem, okay? There were so many people stuck at home because and getting treated by telehealth. Why? Because there was literally physically no room in the hospital. Okay, that's reality, y'all. That is real.